Oh, a presentation is not that long. What I'm going to discuss is how to start your research, publish it while you're in Kaplan. Is it possible? It's too easy. Is it going to help you in you go for research, for residency? Yes. Because I'm an attending. Let's say I'm an attending مثلا في UIC. إذا أنت جيتني and you did all the work until you collect your data وجاي تقول لي I need just expertise. I want to put things into publication and I want someone to call editors and get my research published. No, I'm going to put my name. نفس الوقت you're giving him a picture إنه I did all this by myself. I'm in Kaplan. I'm not only studying. So هو مثلا the thing they against us is why do you need 2 years to study? Our students do it in their own medical school, and they publish, they finish their exams, and they finish their medical school. So why you need 2 years? In another way, شوية كمان volunteer. I'll tell him that I am a multitask person. This is my best word is we're a scholar. We have to do this 2 years. We cannot just come for exams. If you have SACM مثلا MOHI, you have to come. By doing other things, you convince them and you are a multitask person. What I'm doing, I'm on the vascular neurology clinical research fellow in UIC. I do also my master's clinical research. Dr. Somberg was trying to recruit for next year. Next year, first semester, master of clinical research. I worked at Hopkins, although I was not that much happy with this fellowship. But to be honest, I have a pretty good idea about pharmaceutical trials, about FDA's trials, which make my master degree easier. And actually, they made UIC happier because I can run stuff من دون ما أسألهم حاجة. وأنا مخرجة عزوز. So what I want to tell you is, research is easy. You don't have to have a master degree as long as you know where to go for help. You can do researches وانت هنا, and you actually can do researches في السعودية وانت هنا, or use your own. كم nationality عندكم في Kaplan?
6, 7 maybe.
6, 7 nationality. I'll use whoever in Kaplan to build whatever research. To take this research to publication, it's your design. If your design is good, ما في له bios founders ودي الأشياء, they're gonna publish it. وطبعا يعني I'm not gonna publish something فيه له clinical randomized clinical trials. أنا حروح لحاجة there is gap. No one knows مثلا Saudi is a good thing. There is nothing about Saudi in literature. So I'll say مثلا you know what, I'll go over it. So هذا اللي بقوله. By doing research while you're in Kaplan, you don't compare yourself to the US graduate. You compare yourself to the IMG. How many IMG actually thinking about research rather than get your score high? Score as high as possible. Do observership. No one. So by doing a research and showing them that, hey, I know how the system in US works, which is research and knowledge and exams together, then they will feel, well, if I brought this person, he's gonna add to my program. Don't think all the residents know everything about research. No, that's the point of they're not that much of a research. A resident Hassan knows how many in your hospital knows much about research out of everyone.
I think up to 10%, not that many actually.
That's in general surgery. هقولها بالعربي. في الجسم حقتي literally واحد. لأنه اشتغل, he was Indian, اشتغل as epilepsy fellow في Cleveland. He was the only one who knows research. الباقيين, they don't know anything about research. One way or another, you are competing. What did they do? Those came out of Hopkins by helping في DBS register حقتهم telemedicine that was the first one was actually psychology publication, but they use in patients حقنا neurology حقنا DBS. What I'm doing currently, to start with, I planned depression and stroke rate. It was a retrospective study. But بعدين, because we don't have data, we assume that because the data حقنا it's not that clean, we may not make it to publication, so we stopped it. غيرنا project and we made it registry. What is detectors? Detectors is a name, I made it out. So it's actually depression effect. Depression effect in the control of stroke risk factors. So it's a letter من كل الاسم. البروجكت الثاني اللي هو الثيسيس حقتي اللي هو aneurysmal subarachnoid hemorrhage predictors. We try to predict the outcome. Okay. The third project I am helping. It's not my project. It's Dr. Sandy's project, but I'm helping them. The fourth project is something in Saudi. So nothing is going to be done here. I'm going to send the questionnaires to all the hospitals in Saudi. It's like 350. We're going to get the questionnaires back. How we're going to do it, we're going to get someone's name in Hinaka, put it in my project, put this project in Saudi Stroke Association, get the questionnaires back here. But then we're going to see what is the data, and then we're going to see how is the stroke, how is our hospital ready to become acute stroke centers. Okay, what I'm going to do. What do you need exactly to start a project? It's an idea. Whatever idea in your brain. What do you want to do? Anyone? Let's start the other way. What is your specialty of interest? Everyone knows this. What is your specialty of interest?
Cardio for me.
Cardiology. Okay, perfect. So, do you have a question in mind?
Depending on the study type.
No, anything you like. Any area you want to study.
MI.
MI. Let's say, okay. Let's say I'm interested in depression. So let's say MI and effective depression مثلا في outcome of MI. You have a question now. Once you have the idea, you're gonna search. You're gonna go online, search for depression itself, MI, and what is إيش هم في لازم يكون عندك outcome measures. So what is your outcome measures? مثلا death. Let's say death ولا hospitalization. Then you're going to search for any previous study that was done. You're going to find study. You cannot just mimic. Randomized clinical trial, avoid it. If you went over HADL study, it will tell you عادة إنه والله no one touched this topic, no one touched this topic, no one talk about this, we lack evidence هنا. Then those are your points اللي أنت تقدر تستخدمها. The second step is the study design. What is the exact point اللي journal's gonna reject your publication is your